Hi, I'm Dr. Schuyler VanDyke from the TMJ and Sleep Therapy Center in Montana. And today we're going to specifically talk about breathing and anxiety and what's the relationship. So I'm a diplomat with the American Academy of Craniofacial Pain, and we treat people with pain and sleep disorders. And what we find is that there is this huge relationship between breathing and all kinds of other symptoms. Today, specifically, we're going to talk about anxiety and its relationship to breathing. So breathing, you have to understand, is in the hierarchy of our lives, it's first, right? Before eating or anything else. If we don't breathe, we don't live. You can go 3 weeks without eating. You can go 3 days maybe without water, but you can't go more than minutes without air. So breathing is the most important thing that we do. It's the foundation for our health. So it's not really surprising that breathing can be related to anxiety issues. And how does that happen? Well, to understand how that happens, you have to understand a little bit about breathing. There are various books out there that I've got put across the desk here for you to look at and think about purchasing that might help you understand this further. But I'm going to give you a very basic idea about breathing. So we all have to take in oxygen to be alive, right? Well, I try to simplify this in my mind by reading this and rereading this to understand it. But oxygen is not what drives our respiratory rates. It's really carbon dioxide, believe it or not. Well, where does carbon dioxide come from? Carbon dioxide comes from all the cells in our body as a byproduct of the energy that they put off for us to carry on our lives, for our hearts to beat, for our muscles to work, for every cell in our body to be functional. It has to go through this process of producing energy and then giving off carbon dioxide. If we don't get rid of the carbon dioxide properly, we have too much or too little, it affects different things with our body, such as the acidity in our blood. The acidity in the blood can be very detrimental to our nervous system. So our breathing rate is related to carbon dioxide. So for instance, when you look at these books, you're going to read about mouth breathing in particular and how damaging it is to our systems. When we mouth breathe, we lose too much carbon dioxide. So if you're a mouth breather, then you're going to be having low levels of carbon dioxide pressure within your bloodstream. And that low level of carbon dioxide can make you more alkaline. You need more carbon dioxide in that case. Whereas the flip side can be true too, where you have too much carbon dioxide and you need to get rid of some. So that changes the way your respiratory rate happens. If you've got too much carbon dioxide, you'll actually breathe faster. If you've got too little carbon dioxide, you'll breathe slower. And these things affect our nervous system. It can create issues with fear. It can create issues with panic attacks. So if you want to find out more about this, I suggest looking at these books. Any one of these is really good. I tend to say that this Buteyko breathing method is one of the best as a starting point to gain a grasp of what it means to breathe differently. But breathing slower and with your mouth closed and through your nose can help your health so much, and not just with anxiety, many other things. So take a look at these books, learn a little bit more, and if you have more questions, give one of our centers a call through TMJ International. We have centers located throughout the whole United States, and find out more.